My name is Lydia Hanna Ferris. I work as a project manager in Fundación San Juan de Déu in Barcelona, where we are part of the Integrate Large Medical Cohort project. So within the project, I led work package 3 along with Dr. Josep Maria Aro. And regarding my background, I have a background in clinical and health psychology and behavioral and cognitive science, which helped me a lot approach this work package as a coordinating part and also do the scientific part as well. So I rapidly became very involved in both the coordination and scientific activities within this work package, which included overseeing the project management of the activities within this work package, but also directly contributing into the fieldwork.
Can you briefly explain what the endometriosis is, how it affects those who have it, and why is it considered an area with significant unmet medical needs?
Well, to make it brief and simple, endometriosis is a chronic condition in which tissue similar to the uterus tissue grows outside of the uterus, often on organs such as ovaries or fallopian tubes. This can lead to symptoms such as severe pelvic pain, painful periods, fatigue, and in many cases, fertility problems. Despite it affecting roughly 1 in 10 women of reproductive age, endometriosis remains significantly underdiagnosed and under-researched. Many patients experience long delays, primarily before receiving any type of diagnosis, sometimes many years, and the available treatments are often limited to pain management or hormonal therapies, which do not work necessarily for everyone. So because of its high prevalence and the significant impact that it has on the quality of life of the people who are diagnosed by it and the limited treatment options currently available, endometriosis is considered as an area with major unmet medical needs.
Work Package 3 conducted an analysis of medical cohorts. Could you explain its main objectives and why this work is important for diseases like endometriosis?
Well, work package 3, first of all, was called large medical cohort. So we initially started by defining what a large medical cohort is within our own consortium. But so that first part was to define it. Then the second part was for us to conduct a gap analysis to better understand the European landscape of large medical cohorts and to identify the challenges as well as the opportunities for improvement within the European landscape. So the main objective for us was to map what already exists and develop recommendations that could help reduce these gaps in the future. So to achieve this, we involved a wide range of experts across all of Europe, trying to have as many fields of expertise and as many countries as possible to have a representation of the current European landscape, in order to capture a broad perspective on which disease areas mostly could benefit from large medical cohorts. So interestingly, endometriosis was one of the 5 most selected disease areas that are considered with significant unmet medical needs, which could potentially benefit from large medical cohorts and mostly this type of research infrastructure. So to further explore these findings, we also conducted a scoping review of literature. The results were quite striking because between 2019 and 2024, we identified only 1 large medical cohort focusing on endometriosis, while for comparison, for example, we found 16 for Alzheimer's disease or 48 for depression. So this clearly highlights an important gap in the research landscape.
Only 1 large medical cohort for endometriosis was identified in your scoping review. What does this tell us about the current state of research and the opportunities for improvement?
Well, the fact that we only identified 1 large medical cohort focusing on endometriosis suggests that this condition remains significantly underrepresented in large-scale research efforts, despite its really, really high prevalence, because it's 1 out of 10 women, as I mentioned previously, of reproductive age. So large cohorts are extremely valuable as well because they allow researchers to follow large groups of individuals over time and collect diverse types of data and identify different patterns or risk factors that smaller studies might not necessarily capture. So the lack of such cohorts in endometriosis research indicates that there is still a great deal that we do not fully understand about the disease, including its causes, its progression, and how different mostly patients respond to treatments. So at the same time, this gap also highlights an important opportunity by investing more resources into large-scale research initiatives, and we could significantly advance our understanding of endometriosis and improve mostly, and the most important part is patient outcomes. Sorry.
The Delphi study involved 73 experts across Europe. What key insights emerged that highlighted endometriosis as a priority area?
So our Delphi study, as you mentioned, involved 73 experts across Europe from representing different fields and different perspectives, which was very important for us to not have any bias. And one of the key outcomes was that endometriosis ranked third among the diseases considered to have the greatest unmet medical needs that could benefit from large medical cohorts. So many experts expressed satisfaction in seeing endometriosis recognized as a priority area. Others were really surprised that it actually made it as one of the top three disease areas that are considered as areas with significant unmet medical needs and that could potentially benefit from large medical cohorts. And several participants also highlighted that the condition currently lacks sufficient research programs and evidence-based treatment strategies. So it was more of like a surprise to some, but a lot were encouraging the fact that endometriosis made it, and certain experts also expressed their curiosity to see actually what was going to happen in the scoping review, what we could find in the European landscape, what was already existing. So as others also pointed out, that although there's not always a clear starting point in terms of large-scale data for endometriosis, the importance of addressing this condition is widely acknowledged.
How can large medical cohorts advance our understanding of endometriosis? And how might this research contribute to better treatment, patient care, and awareness?
Of course, this is the end goal for all of the research, but large medical cohorts can significantly advance our understanding of endometriosis because it allows researchers to follow large groups of individuals, as I said, over long periods of time and collecting a wide range of clinical, biological, and lifestyle data. So this type of data can help us identify potential risk factors, improve early detection, and mostly better understand how the disease progresses in different patients. It can support the development of more personalized treatments as well and help researchers evaluate which therapies are most effective in real-world settings, which therapies would be more suitable for which type of person. Ultimately, stronger cohort data can contribute to better clinical guidelines as well, improved patient care, and greater awareness of endometriosis, both within the medical community, but most importantly, among the general public as well.
Looking ahead, what gives you hope about the future of endometriosis research and care?
Well, for me personally, if I can speak personally and professionally, I would say, first of all, what gives me a lot of hope as well personally is I know a lot of women around me who do suffer from endometriosis, but it is a topic that has been more and more talked about and they feel more seen. So I think from that sense, it gives me more as a person on a personal level, more hope to see on social media, for example, that it is a topic that women today talk about it and that they express everything that they go through. They talk about their lifestyles. And on a research level, I would say what gives me a lot of hope as well is that endometriosis is now getting more attention in research and healthcare. So there's an increasing awareness as well among researchers, clinicians, and policymakers about the importance of addressing this condition. At the same time, patient advocacy and awareness initiatives are helping bring this topic more to light and more into the public conversation. And projects like INTEGRATE-LMedC cohorts help highlight the existing gaps in the research landscape and encourage collaboration across Europe between institutions, between scientists. So this encouragement will make the data more useful because it would be more used at the end between all of the collaborators, but with improved data infrastructures as well, greater investment in research and continued collaboration between scientists, clinicians, and mostly patient communities, there could be a possibility to improve diagnosis and to develop more effective treatments and ultimately to improve the quality of life of the people living with endometriosis.
Is there something else you would like to add?
Well, I would say probably the psychological impact and burden of having endometriosis that I see really around the people around me. As I have a clinical psych and psychological background, I know that I've seen a lot of women really suffer from this diagnosis, really take it as a turning point in their life, and also having this. A lot of women get some sort of relief from getting this diagnosis because it explains all the fatigue, the painful period, the pelvic pain. It explains it to a certain extent. But then the pain of this diagnosis, of not having a treatment to treat it, as it is a chronic condition, there are only treatments to manage the pain. So I would mostly talk about the psychological burden, which is really, really, really present. And I just want to say that if anyone who's watching this knows a person who is going through endometriosis, check on that person and make sure that person is doing all right.